Let's begin with the lecture Hepatocellular Carcinoma, and in the first section of our lecture we will talk about the etiology of hepatocellular carcinoma, what's the clinical features of hepatocellular carcinoma, and also some physical signs and paraneoplastic syndromes associated with hepatocellular carcinoma. Most common malignancies is hepatocellular carcinoma. So it's a common malignancies involve the liver. The liver is the organ present in the right upper quadrant of the abdomen below the ribs. So unless only the edge of the liver sometimes we can feel, but usually it's not palpable, and only when the liver is enlarged we can easily feel the margin or liver in the abdomen. So it's the most common malignancy of the and its male to female ratio is 4:1. So males are more commonly affected with the hepatic carcinoma or hepatocellular carcinoma. It is associated with high endemic HBV carrier rates. HBV is hepatitis B virus. So people who are infected with hepatitis B virus, and the areas where the hepatitis B is common, usually those are the areas where there is more hepatocellular carcinoma rates. And there is mycotoxin contamination, so it's also associated with mycotoxin contamination. The people who are obese and overweight, they have liver disease, which is mostly NASH associated, and that's common in patients who are overweight and obese. The etiological factors associated with hepatocellular carcinoma, some chemical carcinogens. Carcinogens are the substances which are capable of causing malignancy or carcinoma. So some chemical carcinogens like the product of aspergillus, which is aflatoxin B1, is associated with hepatocellular carcinoma. Then aflatoxin contamination of food. Peanuts, grains, if they are intoxicated by the aflatoxin, that can also cause hepatocellular carcinoma. Then chemicals like pyrrolizidine alkaloid also cause hepatocellular carcinoma. Tannic acid and saffrol. And pesticide and insecticide these are the rodent carcinogens. So all these are different chemical carcinogens that can cause hepatocellular carcinoma. Some other causative agent, hepatitis is important. There are different types of hepatitis A, B, C, D, E, but hepatitis B based hepatocellular carcinoma is there, and there is destruction of hepatic tissue. The liver tissue is destroyed as a result of hepatitis B virus infection, and this destruction can cause further changes and leads to hepatocellular carcinoma. There is proliferation and frank cirrhosis of the liver occur as a result of hepatitis B virus. Then also we have hepatitis C virus-based HCC or hepatocellular carcinoma, which frequent leads to the cirrhosis. More common, the hepatitis C virus infection can lead to cirrhosis of the liver. So you can see the cirrhosis liver, all destroyed, damaged, and the cirrhosis. So both hepatitis B and hepatitis C can lead to hepatocellular carcinoma and the cirrhosis of the liver and the destruction of the tissues. Some other etiological conditions, then we have common factors, cirrhosis from any cause other than the hepatitis B and C can cause non-alcoholic fatty liver. Fatty liver can also cause cirrhosis of the liver, and it's can progress to hepatocellular carcinoma. Hepatitis B or C infection, ethanol chronic consumption. Chronic consumption of the alcohol. People who are alcoholic and they drink alcohol on the regular daily basis, they are prone to develop cirrhosis of liver and then hepatocellular carcinoma. Then NASH, NAFL, which is non-alcoholic fatty liver, non-alcoholic fatty liver, and non-alcoholic static hepatitis. All these are the common factors that can lead to the cirrhosis and hepatocellular carcinoma. Then we already talked about aflatoxin, B1 or other mycotoxins that can cause cirrhosis of the liver and hepatocellular carcinoma. So these are some common factors. We have hepatitis B and C infections. We have fatty liver can cause the cirrhosis. Ethanol and alcohol consumption can cause cirrhosis, and then we have aflatoxin B1 and NASH and NAFL, which is non-alcoholic fatty liver. So these are different conditions that can cause hepatocarcinoma and cirrhosis. Some other unusual causes of the hepatocellular carcinoma or cirrhosis, we have primary biliary cirrhosis. Primary biliary cirrhosis, this is what a normal healthy liver look like, and this is the liver with hemochromatosis. It's a condition in which there is deposition of the iron on the liver. So this is hemochromatosis. Primary biliary cirrhosis, hemochromatosis, alpha-1 antitrypsin deficiency, glycogen storage diseases, citrullinemia, and then we have porphyria cutanea tarda, hereditary tyrosinemia, and Wilson's disease. So these are all the other etiological conditions and factors which are not very common, but still they can cause cirrhosis and hepatocellular carcinoma, primary biliary cirrhosis, hemochromatosis, alpha-1 antitrypsin deficiency, glycogen storage diseases, porphyria cutanea tarda, hereditary tyrosinemia. These are different conditions that can be lead to hepatocellular carcinoma and the cirrhosis of the liver. In both, there is poorly bad destruction of the hepatic tissue and destruction of the liver. Clinical features, the symptoms include abdominal pain and swelling, weight loss, weakness and swelling, There is jaundice and nausea. There is jaundice, which is yellow discoloration of the skin due to increased level of bilirubin. This is very, very significant diagnostic of the liver disease or hepatitis. Underlying chronic liver disease, central necrosis or acute hemorrhage, hematemesis and portal hypertension and bone pain. So all these are the symptoms associated with the hepatocellular carcinoma, cirrhosis of the liver. There is pain in the abdomen and swelling in the right hypochondrium and the upper quadrant of the abdomen. There is weight loss, nausea, weakness, swelling, and there is jaundice is also present. Hematemesis is blood in the vomiting, so there is blood in the vomiting is present because of there is portal hypertension and increased pressure. Bone pain also present. Physical signs are there is hepatomegaly and Budd-Chiari syndrome. There is enlargement of the liver and the liver is felt under the lower rib margin, lower costal margin, and there is hepatomegaly. You can see very big enlarged liver. There are abdominal bruise and splenomegaly. Enlargement of the spleen is also present. Ascites and muscle wasting. Ascites is very, very common associated with the cirrhosis of liver. There is fluid in the abdominal cavity and that's the ascites. There is muscle wasting also. Dilated abdominal veins. There is palmar erythema. You can see there is redness of the palm and palmar erythema. Rashes are present. Gynecomastia is enlargement of the breast tissue, enlargement of the male breast. And testicular atrophy and peripheral edema. You can see there is peripheral edema, the legs are all big and swollen. So all these are the signs of the cirrhosis and hepatocellular carcinoma. Liver is very large, there is peripheral edema, swelling, palmar erythema. Very, very diagnostic finding of liver disease is the ascites if it's present, fluid in the abdomen, and then there is dilated abdominal veins, splenomegaly, abdominal bruise. All these are associated with the liver disease. Paraneoplastic syndromes are the features of the paraneoplastic syndrome. Biochemical abnormalities, hypoglycemia, erythrocytosis. There is increased red blood cell, there is decreased level of the glucose, hypoglycemia in the blood. There is hypercalcemia and hypercholesterolemia. Increased level of calcium and cholesterol is present in the blood. Dysfibrogenemia, carcinoid syndrome. Increased thyroxine binding globulin. Changes in the secondary sex characteristics. Porphyria cutanea tarda. Thrombocytosis or thrombocytopenia, and there is elevated interleukin 6 level. All these are different paraneoplastic syndromes. These are the syndromes associated with the neoplasm present in the other that cause involvement of the other structures or body. So there is biochemical abnormalities, hypercalcemia, hypercholesterolemia, hypoglycemia, erythrocytosis. These are different paraneoplastic syndromes associated with the hepatocellular carcinoma. This was all about section 1, in which we talk about the etiology of the hepatocellular carcinoma and also some paraneoplastic syndromes and signs and symptoms of the carcinoma. Thank you for watching sqadia.com.